anyone to ask questions. And I'm just thinking about the best way for people online to actually ask those questions. Probably it is about putting up their hand or putting something in the chat, and then we'll try and shoot over to you for a question. So over to you, David. Welcome.
Thanks very much. Thank you, Adrienne. And people online, I think you've got me on the side, but it's my best side, so that should work out really well. Thank you, Adrienne and TASCOSS and the Peaks for the opportunity to be here to talk about this particular project. What I planned to do was to obviously speak to the project, but initially contextualise the project, because indexation is important, but it's one foundation stone, if you like, in terms of sustainability across human services. And so I want to just speak to that proposition a little bit before we get into the indexation program particularly. The other thing I'd say is I'm really happy to take questions and comments as we go, so just dive in. Let me know online too. We can hear you loud and clear, so please do let me know if there's something there that you'd like to talk about, or like to challenge, or like to ask about. I'll be really happy to take those questions. So please share them. In terms of the cost indexation project, so my role is as director of the UWA Centre for Public Value, and we are fundamentally concerned about human services, its sustainability across Australia, so in all the states and territories, and at a national position, and indeed looking at not just sustainability in terms of indexation, but broadly across what we might call the sustainability of the system. And a great example I always use is the NDIS, because most people at least have some idea of the challenges facing the NDIS and how it's been rolled out. But essentially the NDIS is an important program, but it's within the disability services system. So we take a higher level sustainability view of the whole system, not just the programs of service that are procured by governments in that system. The other thing that we do is we're trying to, I guess, take a more mature view of the economics of human services in Australia. And that means understanding, for instance, the need for charities and not-for-profit organisations that have services procured by governments from them to be able to have those services procured at a price that not only allows them to cover their comprehensive cost of service delivery, but also delivers a profit to those organisations in order to be able to drive the construction of their balance sheet, which then allows true sustainability in the short, medium and long term. Now, again, I'm really happy to go through those things in more depth, but essentially, to my mind, there's a couple of things about the discussion that really need to be framed. The first thing is that the aims of this project are essentially threefold, as you can see there. They are to ensure or to support industry level sustainability. So one of the things that I don't talk about is individual organisations. They have to operate within the system, and we can talk about specific questions and comments in that regard. But making sure the service mix is appropriate. And I talk about service mix a bit because what we tend to do in Australia is talk about human services at the very highest level. We talk about policy adjustments and tweaking at the highest level, but don't really understand what impact that has on the service mix. In other words, what services are actually provided on the ground, and how do those services change as a result of the economic signals that are provided by governments in terms of the price they might set out. The third point on that slide that I think is important relates to service sustainability. When I talk about sustainability, I'm not talking about survivorship of charities and organisations. I'm talking about sustainability of the quality, quantity and time in services delivered. That is, that the service mix is the appropriate quality, the appropriate quantity, and delivered at the appropriate time, because that's fundamentally the whole purpose of this industry and how it moves forward. So essentially, sustainability, when I talk about it, I'll be thinking about or have in mind those concepts. What does that mean? It means a couple of things. As I said before, it means organisational sustainability for the organisation's sake is not something that we look at or that we're concerned about. Clearly, directors and others have responsibilities in that regard, but it's not part of this program. The second is that we're really looking at the system and the system's health. How does the system deliver the services? Now, the system includes the not-for-profit charitable service provider organisations. It also includes governments, both state and Commonwealth. It also includes advocates and supporters of those organisations that are representing the users of these systems. And one of the phrases I commonly employ when I talk about this system is the fact that the service users, those people that rely on the services, are actually the shock absorbers for change in the system. They're the ones that are actually untransparently impacted by funding changes and the outcomes, because we don't measure those. So I'll talk a little bit more about measurements and transparency as we go. So what's the rule in terms of indexation? The first rule is that indexation, if we get it right, helps in 3 areas as far as I can see. It helps to insulate against unexpected service failure. So it helps us to keep organisations in money so that they can continue to provide services. And where there is extreme financial dislocation, those services can actually be observed and identified. It helps us to maintain the service mix, and I talked about that before, but fundamentally, we don't really have an eye over the service mix of human services in Australia. We have an eye over the financial impacts. We have an eye over, if you like, how many widgets are purchased or procured by government, but we don't really have an eye over what the impact of that is. It's not very transparent, but it helps us maintain that service mix. And I guess the principle for me is any material change in financing does change the service mix, because organisations have to make decisions about where they use their resources, how they allocate those resources, what their priorities are. And also, I think what is really important is that we're concerned about this indexation problem, not just from the sector's sustainability perspective, but also from government's perspective. I don't think anyone in the sector wants to see government wasting money or to be inefficient in the allocation of resources. Taxpayers certainly don't want to do that, and governments don't want to do that. So having a transparent, appropriate indexation process helps government manage its budget, and more importantly, it's out-year forecasting, so it's got solid ongoing forecasting. What doesn't it do, though? Indexation doesn't help with mitigating cumulative, inaccurate or inadequate indexation gaps. So over time, if you don't get indexation right, as I'm sure you're well aware, and I'm sure you're experiencing in your organisations, the gap between the cost or the price that's provided and the services cost is growing all the time. And if you don't get indexation right, each year on year, that gap increases. It also doesn't meet significant cost increases in real time. And I think the one good thing I mentioned this morning, is say a good thing about COVID, is that it really highlighted some of the things that we've, as accountants and others operating in the sector, identified as risks. It actually realised or crystallised those risks. So some of those risks include things like significant cost increases to keep delivering services. Indexation can't preempt that or forecast that, and can't respond to that. I think the other thing that indexation can't do is mitigate the capital shortfalls resulting from government policy change. When government changes its policy, of course, that has significant impacts on organisations that provide services that are procured from government, and it means those organisations have to change some ways. That might be that they have to change IT, it might mean they have to change location or other physical aspects of what they do. It might mean they have to train people or hire different people. All of those things need capital to be able to support them to do that, and indexation doesn't provide that. And finally, it needs to respond, or it can't respond rather, to changes in need for services. Indexation is typically retrospectively identified, and then it is prospectively applied, but in the context of the demand and operations of organisations in that previous period, if you like. Now, I'll talk to these a little bit more, but are there any questions or comments just while I'm at?
What you're making.
That's what I like to hear. I'm gonna take any more comments now. I'm happy.
So just the second one, and the significant increase in time, which I 100% agree. But what's happening at the moment is that where organisations have had some surplus and probably banked it for like a project or something. Yeah. Because of the gap, that's being drawn down now, and it affects things in future years. So while I agree with that, organisations are trying to work other ways around it.
Absolutely.
Having an impact as well.
Yeah, and so we've got an hour, I think, today, and I'm really keen to get discussion. But one of the things I think leaders in the sector need to assimilate, I think there's 2 things they need to assimilate, and really happy to be told I'm wrong if I am. But the first one is, I think often the sector takes responsibility for the budget parameters that government has to procure services. And I often use the example of road maintenance organisations. Road maintenance organisations, number one, get 100% of their funding from government if you want funding, but number two, they tender for those services and they get the full cost or comprehensive cost of service delivery. Whereas there seems to be an expectation for organisations to put their hand in their pocket. And I'm being very general and, broadly across Australia, there's specificity in what I'm talking about, not just location-wise, but also in terms of specific programs and so on. But generally, I'm understanding where you're coming from. I'm also thinking, secondly, that is not acceptable. That organisations create reserves for a number of reasons. They might cash back employee entitlements, they might have to replace their IT at some point, etc., etc., etc. To dip into those fundamentally impacts sustainability. So while we typically talk about sustainability, and my definition of it is ongoing capacity to deliver the right services at the right time in the right quantity, I think there is short, medium and longer term sustainability that needs to be considered. In other words, any organisation that operates in human services not only needs to be paid an appropriate price, they have to cover their costs and make a profit. It's fundamental in a markets economy. So having said all of that, what does sustainability look like? And then where does it sit in the sustainability formula, if you like? And I think it sits like this, where we have, in no particular order, but if you think about sustainability in the terms I've just defined, you can see that we need to realign funding on, say, a 5-year comprehensive tender basis in order to be able to what we call rebase any indexation factor that's used. In other words, we have to go out to the market, so to speak, at least on a regular basis, but 5 yearly is probably about right, in order to understand what the comprehensive cost of service delivery is and then move forward from that base with indexation, if that makes sense. So in other words, we have to rebase or have some way of understanding what the comprehensive cost over time is. If we think about, and I keep picking on the poor NDIS because people seem to kind of recognise the challenges, but for instance, in that regard, the NDIS pricing is not based on what it costs to deliver services. It's not based on tenders that were provided in relation to that. It's based on how much money government's got to spend. And that's, you can't, the widget is not able to be purchased for how much I want to buy it for. I've got to stand in the market as a demander and to get that widget at the price that I'm going to get a comprehensive and appropriate quality service for. So that's the first column. The second column is too that when we have policy changes or as things change within the community, we need to see capital injections into the sector in order to be able to facilitate that change, to be able to innovate, to be able to invest in staff and so on and so forth. Which again, if I look at the NDIS, as you know, NDIS doesn't cover things like staff training. So there's a number of what I would call capital factors that need to be built into the funding environment to be able to make it work. The third element is our focus today, which of course is the indexation model, which is the annual response to cost experience. So if you like, a 5-yearly response to realign the base, to be able to understand what the true cost of service delivery is going forward. The second, the appropriate capital injections to be able to maintain that sustainability in terms of capital capacity. And then thirdly, looking at that indexation model year on year to be able to make it work. Does that make sense to everybody?
Yes, but how do you factor in things like the things that happen from time to time, like for instance COVID?
Yeah.
Which is obviously a workforce thing, but it also out the other end of that, you get a lot of social issues that might arise and
Absolutely.
demand and the like. So how does that model capture that? I mean, is it just the annual sort of review or something? Is that what you're suggesting?
Yeah, I think there's a few things. So COVID is a hopefully once in a lifetime or once in a long period of time impact.
We'd all like to think so.
We don't think so, yeah. But bushfires and floods and all of those things, we know is becoming more and more prevalent. What I would argue is essentially two responses to that. The first one is with COVID, I think we need to step back and actually look at the mental health and other effects. In fact, I'm just writing a paper looking at the mental health impacts of COVID lockdowns, which were substantial, and the lack of injection of capital into mental health organisations to cope with that extra demand. And so I do think that when you have those problems, you've got to institutionally stop what you're doing and reframe and look. And I think the evidence is there to suggest how to go about that, as I say, for instance, in relation to mental health. But I think the second and most insidious problem we have today, an age where we have significant technology capacity, is the lack of transparency over outcomes in relation to service delivery in this sector. So that not only were those mental health issues identified by our centre, but those mental health issues were understood at the coalface by providers of mental health support services, but there was no tracking of that from government's perspective, no way to collect that demand. So this is a whole different conversation, which I'm delighted to have, so it's no problem going down that path, but it is different in the sense of when we think about the economics of this sector or talk about policy in relation to this sector, we tend to talk different economics to that which we apply to the rest of the world. And that includes in relation to demand. So demand is actually created by government in economic terms. Because as soon as government says this is how much money we've got to spend on this many widgets, that's what in economics terms the demand is. What we don't understand, what we don't measure is what the need is. And that's where your comment becomes really prescient, because we're not actually transparently monitoring those spikes in need and injecting capital where we need to make it work. But of course, it's not just capital, there's got to be trained staff and other things as well. So it's not as easy as I've just portrayed. But I do think that transparency issue is a major issue.
Reserve Bank, ups interest rates, and all of a sudden you've got a heap of people that are homeless because they can't afford to keep their home. It's silly. But, it's not a great space.
No.
They have to try and work out an indexation model that's going to handle that.
But also, because you slip into procurement project and how government should procure services, it's the indexation on the service. Yeah, it's hard to separate.
It is.
Why you're keeping it in that third column, isn't it?
That's exactly right. So I'm talking about the systemic response as opposed to, should the RBA raise the interest rates? What are the homelessness impacts of that? And then where does the capital need to go? I don't think the transparency track of that is very hard. I think that can be done. What governments don't have an incentive to do is to actually track that and to respond accordingly. And we're seeing that across human services. The other thing I think where you're coming from, I make a comment is we don't look at the economics of this sector. We talk about economics of mining, tourism, you name it. We talk, even health, we talk about the economics of health, but we don't talk about the true economics of this sector. And I think that's a real problem too, because the extension of that is, had we applied mental health resources and other things in more timely fashion as a result of COVID, we wouldn't have a long tail of increased demand, but also there'd be economic and other consequences that are positive. For instance, return to work is a really important aspect as well. So I think it's talking about the economics of this that's really important. Going back to the final comment that you made in terms of procurement, I think that's an important issue as well. We have a lot of commentators talking about the charitable and not-for-profit sector getting government funding to do things. Government's actually buying services off you in the same way as government buys services off of those road maintenance people, the bridge builders and so on. There's nothing wrong with that, but it's not funding. It plays in the community as if the government's coming here, have a bit of day, see what it can do. It's not funding, it's pretty. I think we should change the language. That makes sense. Yeah.
But those big one-off events like COVID, indexation policy can't cope with that.
No.
It needs to be a flexible procurement to say needs gone up like this, so therefore.
JobKeeper is a great example. Like I thought JobKeeper worked well. You can argue whether it should have been shortened, less and greater, whether some people are good, some people, all of those things. But as soon as something like COVID hits or the GFC hits, government's got to respond. That's where that kind of thing becomes important, responding. So, for instance, I suggested JobKeeper should have been doubled for the not-for-profit charitable human services sector because that money would have been spent in the raise the economy outcome instead of, accountants and lawyers were the first ones to get on the bandwagon, and it went to partner pay. Right? So I think there is a real opportunity there for us to rethink how we position
It's a
it.
fundamental shift, isn't it? Years ago, I worked for Metro, and it was all, Metro's making a loss. No, it costs the government X to provide those services for people.
That's right.
You have no other option.
That's right. That's right.
It's not a loss.
No, and that lack of transparency is a really important issue. So to go back to NDIS, one of the things we've just forced the government to do in Western Australia was to come clean on how much primary healthcare beds were taking NDIS recipients that were unable to be funded or supported out of NDIS. So we pay all this money to NDIS as taxpayers, then we pay more money for the same people because this isn't working, so we're paying more. We need transparency across those things to make it work as well. But essentially what I'm talking about here is sustainability in the ongoing basis, not in terms of shocks to the economic or social fabric. People online, is there anything you want to ask or are you happy? Oh.
But there's 47 people online, so
Fantastic.
there you go.
All right. I might pay more attention to you guys then, because there's not as many in the room. Okay, so what is a cost index? Now, I think most people have an idea of what a cost index is. Generally speaking, that is a percentage applied to the base rate, whatever that might be, year on year to achieve cost recovery.
Sorry, David, just a couple of the comments. Sound is better if you're a bit closer
Closer.
to the laptop. Yeah.
Okay.
You. And it is a bit difficult to sometimes hear questions from the room, so
Okay.
just get repeat.
I'll repeat the question.
Thanks.
Thank you. I feel like I'm telling a joke now. It's the Irish, the old Irish comedian. You remember David, Dave Allen. Yeah. I feel like Dave Allen. May God go with you.
Hopefully you got more fingers than David.
Yeah, exactly. Yeah, I've got all of them still.
Don't have the cigarette on.
No, or the whiskey. Well, we should change that immediately as well. Okay, so what is a cost index? All I really wanted to do is make sure we're on the same page, because it seems at one level, talking to people, that cost index is really just a percentage additive. But it is actually a process where we try and not only work out what the comprehensive cost of service delivery was over a particular period, whether it's a month, 3 months, 6 months or a year, but we also want to work out the proportionality of those costs. So we want to understand, for instance, and I'm sure you're all well aware, that human resources costs for human service organisations are somewhere between 70 and 75% generally, 73, 72%. But other costs have a proportional impact as well. So when we create or calculate an index, we have a formula that doesn't just collect the prices of all of those goods, it actually works out the proportion of those goods in the context of the operation. So it's a little bit more complex than just simply seeing what the change has been over time. And really happy to talk about that a little bit more. But in terms of a cost index that works for the human services sector, there does need to be two things. One, it needs to be relevant to the cost and proportion of costs that are part of the comprehensive cost of service delivery. And number two, it has to be collected on data that is as young as possible, if you like, in order to be able to make that as relevant as possible. Now, in terms of that, statistics are the same no matter what location and no matter what industry you operate in. And indeed, we have already a model in statistics that would work nicely for a cost index for human services organisations in Tasmania called the Fisher Index. But we want to think about that in the context too of the cost of collecting data, the cost of analysing the data, and the cost of populating that index to understand what's going on. So it's not just a case of having an index and saying, okay, that's what the prices were and the proportion was. There's an ongoing updating of our understanding of those cost components. This is really important of late, because we've seen, for instance, people transitioning from buying software, so going to government for grants, philanthropists for grants, and buying software and putting it on machines, to paying subscriptions for software. And some of those subscriptions can be $250,000, $300,000 a year. So instead of getting capital, which I know this comment's probably going to get a brick to my head, is relatively easy in Australia, in the sense that getting a capital thing from philanthropists is much easier than getting ongoing operations. A fundamental change in what we call the business rules. So what are the cost components in terms of IT going to subscription bases instead of capital purchases has a fundamental sustainability impact on organisations, because you can't go out to a philanthropist, get a cheque for 100,000, buy the software and move on. So I think this cost index element is a really important issue of what it is and why it is so complex in terms of arriving at something. The other thing that I would say too is that the Australian Bureau of Statistics calculates a number of industry indexes, including Health and Social Service Index, which includes this sector, but it's not only this sector, it's the whole health sector. And it also creates indexes for another number of other industries, much smaller human services industry in Australia, with much less economic contribution to this particular industry. But all I'm saying there is that the ABS already collects some data for this sector, and I think the sector needs to agitate, to advocate, to have the ABS do two things. One, increase the data collection into the sector in order to be able to create an index for the sector. So disaggregating health from social services so that we know what the social services industry is delivering in economics. So I think that's a national advocacy piece that the COS network and others, Care, etc., be involved in, because I think that's important. Just to give you an idea, the last time that the ABS collected non-profit specific data was 2013. They have no schedule for data. So even though it's the second biggest employer to government in Australia, we don't have our national statistician looking at the sector at all. Okay. Nothing on that? No? Okay. So current methods used, there's a number of methods that are in play, and I wanted to really focus on a method that is quite common in Australia, but also I'm aware all of the treasuries are talking about in Australia, and that is a combination of the wage price index, so the index for wages growth in the economy, and CPI. And I want to talk to you effectively as to why those two elements aren't really appropriate to be able to be used surrogates or approximation for this particular sector. And I know the Tasmanian indexation is fundamentally based on CPI. There's some real problems to my mind. I'll go through them now. Suffice to say, though, that there's two fundamental problems before you start with anything. As statisticians, we're really keen to make sure that we're comparing like with like, that we're actually comparing oranges with oranges. But what we find is that the WPI is measured by state, whereas CPI is measured by city. So CPI applying to Hobart could be used to create indexation in terms of government discussions. WPI relates to the entire state. So there's a real mismatch there in terms of the statistical usage. But what about the CPI? Now in this slide, what we've done is we've just listed the key things that we think are important in terms of understanding indexation for the human services sector. And those things are listed in the middle with a tick down the right-hand side where human services specific indexation model should capture those items. So what we're saying is they're the kinds of items that should be captured. I'm really happy to distribute this slide. We're happy with that, aren't we? Yeah. So, did you get me in the photo though? Yeah.
Let's take the pick and then I write notes.
Okay.
No, I speak, so it marries them up.
No worries at all. No problem. But really happy to distribute them. So the key is that CPI, as I'm sure you're well aware, relates to price increases for a basket of goods that are consumed in operating a household. Now, that means that there are many issues in relation to what we call the business rules of the human services sector, so the cost components, that are simply not covered by CPI. And you can see there things like operating purchases like IT, subscriptions, PPE, etc., new goods and technology, significant savings or investment components, land, capital, all of those things are part of the economic, but are not represented or taken into account in CPI. And in fact, in CPI, we've got some household utility living standards. Over average household costs are represented, but also elasticity in discretionary and discretionary spending is represented in CPI. By elasticity, I mean that as your budget becomes tighter, you have certain costs that you can decide not to consume, or certain goods to not consume, or you might swap your consumption to cheaper goods. Does that make sense? There's also goods that you have to consume, water, electricity, and so on, that they're not discretionary. You must expend those items. And so CPI calculates both a discretionary and a non-discretionary element. The discretionary element is really important because if we're seeing increased fiscal pressure on households. Those households increasingly make determinations about what they're going to spend money on, and therefore any expenditure items that are discretionary in nature will maintain their price because people will withdraw from buying them. Does that make sense? Whereas non-discretionary items, you can keep putting the price up in response to economic challenges because people must have those things. So the key issue here is when we look at that in a graphic sense, applying the CPI to the sector is really problematic because in fact the sector, of those CPI components that are relevant to sector expenditure, it is non-discretionary components in that basket, not discretionary components. Now this graph is just a 10-year take. It's not apropos of anything other than to demonstrate that when we look at the discretionary expenditure, CPI is going up, but is much lower non-discretionary expenditure. Point is the CPI figure is the line in the middle. This is the one that actually impacts expenditure for human services. Does that make sense?
Yeah. The other thing, David, and I'm misunderstanding how that's worked, but my experience in the last 14 years is the government hasn't used CPI.
No, that's correct. That's correct, according to the Act. Yeah. All I'm trying to do is to give you a bit of an understanding of where a lot of governments around Australia position this, and state governments typically in Australia follow each other. They like precedent that's been created elsewhere. And so I'm trying to give you a bit of an appreciation of what's going on. So essentially though, this is a real problem. Those components, no, it's good. I think it's really
It would be good if it was to have that CPI.
Yeah,
that would be great.
Even CPI helps, but it's not connected to the consumption costs of nations. The point being though, of course, that CPI should be only on the non-discretionary items because the organisations only spend non-discretionary items or purchases, and therefore it's that higher level. While CPI is the balance of discretionary and non-discretionary. What about WPI? WPI is actually one of the hardest things to get your mind around as to why it might not be relevant to the sector. We've already said that the sector has somewhere between 70 and 75% employment costs. And so WPI, the wage price index, seems to be a really logical place to start when you're thinking about indexing costs because of that substantial human resources element. This is a highly workforce intensive sector. You can see there, same again, the wage price index does or doesn't have these components that we think is important. Human services labour costs include those components that are not taken into consideration in the WPI. It is a difficult thing to describe as to why it doesn't apply, but essentially the attributes of this sector are such that you have, as you know, predominantly woman workforce, predominantly casualised labour, predominantly very low paid. And so the proportional impact on WPI by the sector is low, whereas the net increase to individual service providers can be quite substantial and harmful because the margin is so low in human services providers. But also we've had ERO, we've had the Australian Fair Work Australia announcements and so on that all impact the cost of human services staffing. The other things that impact the cost of human services staffing that are not taken into account by WPI all include things like superannuation, and we've had increases in superannuation, I think of 1% up till now, with prospective increases going forward. Those don't get captured by the wage price index. One question that has been raised is, well, why do industry use the wage price index, other profit-making industry? And they use it as an indicator to help them to understand what the costs of wages have been across the economy, to then be able to negotiate with unions and so on. Whereas a lot of states and territories use WPI as an indexation point to say what the increase in costs have been for profits and charitable human service providers. And that represents a real problem when you don't include things like 0.5% increase for superannuation, for instance, that has a material impact. Does that all make sense?
David, the question came through about CPI and wondering that's by city. How do you know how many ads are captured, and then that means?
Yeah, so taking the second question first, it means regional areas have the same CPI applied as would be relevant to the capital city. So we use a combination of WPI and CPI in Western Australia, which means Perth's CPI is applied in Wudjimultha. Now, Wudjimultha is near the Tanami Desert, up in the very northwest of Western Australia. It's 1,000 kilometres or so from Perth. Guess how much a litre of petrol is in Wudjimultha? Ain't cheap, ain't cheap. So we're heading up there in a little while, and we're budgeting $5 a litre for fuel. So that's a big difference to I think it was $1.78 or something I paid yesterday. So those are the real kinks in the idea of having a city-based CPI applied. Now that might be less relevant in Tasmania because it's a more compact state, perhaps, or you know, you would know much better than I, but certainly that's a real. Okay, so one of the things that I wanted to share with you as well, we're doing two projects essentially with TASCOSS and the Peaks at the moment. One is looking at this indexation thing and trying to come up with an indexation response that makes sense. The other is to actually look at the state of the sector. And we've been looking at various data sources, including ACNC data, Commonwealth Treasury, ABS and Tasmanian Treasury data to try and get a sense of what's happened in the sector and its sustainability over a period of time. And I wanted to include this slide, I guess, to reinforce the importance of this sustainability debate and to drive this, or to I guess gird people's loins in terms of moving forward, not only with the indexation, but the other two pillars of sustainability as well. And so some of the key things that we've identified in relation to the state of the sector include that aggregate surplus reduced by 10.5% between 2018 to 2020. So looking at 2018 to 2020 data for a number of reasons, I'm happy to explain that. But at the end of the day, aggregate surplus reduced by 10%, which I think is a material and significant reduction in aggregate surplus for organisations. Now, if I had my way, that surplus word would be replaced by profit, because I think we should, as a sector, be talking about generating a profit for sustainability in the medium and long building balance sheet. But surplus is the word that most organisations still use within the sector. The other thing was that 54% of Tasmania's charities did not cover health CPI in 2020. In other words, their profit or their surplus level was subordinate to or less than health CPI's growth in that period. Now, to me, to at least cover your costs and make sure you're maintaining some sort of continuity with changes in prices, you need to be meeting that health and social services CPI. I don't think that's a very significant line, but as you can see, 54% of Tasmania's charities didn't do that. The other one that's really interesting is that in terms of service growth, cost the sector $322 million to gain $313 million income. So in terms of growth to the sector, you had $313 million worth of additional service output. That cost you $322 million to provide. So the margin across all of your operations is too low. There's no opportunities for economies of scale. The bigger you are, I suggest the bigger the problem you have in terms of financial sustainability. Service mixes probably changed as a result of those changes. In other words, there'll be untransparent or invisible changes to the level, amount, quality of services that are actually provided in, just not aware of. The ERO and wage case decisions, of course, make a big impact here, as do the health and social assistance industry contribution, though, of almost 14% of Tasmania's GSP. So across your industry grouping, you contributed almost 14% to GSP. So GDP at a national level, GSP is the state economic activity.
ERO, David, for the other mission?
Oh, so that's the equal remuneration order. So the state, the Commonwealth came out and said, okay, everyone has to lift it because they're so underpaid in this sector. Some time back, but that's been creeping and creeping and creeping, and magnitude of it being much more impactful. I think this is a really important one for anyone in the sector to be aware of and to be advocating, not just to the government procuring agencies, but also to the general community, anyone listen. This is a net 14% contribution to the Tasmanian cost, a net 14% contribution. Really important consideration, I think. And then the final point is the number of deployed volunteers reduced between 2019 and 20 by 6,000. I don't think there's any there that would be surprising to you either. I'm sure you've got it. Suffice to say that we would expect that there would be some solvency or financial sustainability issues caused as a result, particularly of those organisations that might have tendered for service delivery, expecting to have volunteers deliver services and suddenly finding out those. Going for time.
10 minutes. Over 10
10 minutes?
Yeah.
Exciting, isn't it? So we're building to a crescendo.
If we can just go back to that previous line about the sort of, I can remember, I don't know my age, but it was 15 years ago back. When Tasmania went from 3.4% indexation to 2.25%, years ago, the same state budget, they announced I think it was $110 million underwriting of forestry Tasmania, as it's called that.
Yeah.
And they had just less than 11,000 staff, and our sector had more.
Yeah.
So they underwrote another part of their service.
Yeah.
But reduced our funding.
Look, I'd love to chat with you all night about this, but
Oh, sorry.
I'll reframe the question. Yeah. So what the question was that there are industries that government is supporting that deliver less to the economy in terms of employment or economic outcomes by significant factor compared to the economic outcomes delivered by the human services sector. Is that a fair?
Yeah.
And I think that is absolutely uniform across the Australian economy. Every state and territory and the Commonwealth do not appreciate the position of this sector. And I think it's to do with, there's a bunch of mythologies built up about this sector over time. The profit is one mythology that's built up that we need to rectify. One of them is that actually economics don't apply to this sector. What we've got to do is reduce our expenditure as much as possible. And then we go and support other sectors. And the motor vehicle industry in South Australia is a classic example where it contributed a net nothing to the economy. And yet the taxpayers paying for that all the time, whereas this sector they're not supporting. So I think it just reinforces that issue of changing the narrative around the economics of the sector and the contribution the sector makes, not just, again, advocating to government, but to the community about what value this sector is.
Another question, David, and it's about fixed project-based funding.
Yeah.
Covering real costs and enabling sustainability. So this Jen, I was trying to just answer from, saying that it is, indexation is really important, but another key issue is that government funding is in budget cycles and Treasury prefers set known amounts. So that challenge of having influence fixed project-based funding that's just kind of rolled over but not
Keeping up with costs. Yeah.
So how do we cover the real costs?
Yeah, so there's a number of, and again, we could probably chat all day about this as well. There's a number of issues there. I think the first issue is that contracting arrangement and government setting the parameters for the contracting. And I think that this is where the sector needs to be more courageous and more happy to walk away from those negotiations, because at the end of the day, government says, well, we have to have that for out years, and the sector takes responsibility for meeting those budget constraints. So I keep picking on poor old WA, but we've made $6 billion in the last financial year, and the Treasury is talking about financial constraints for human services. So that's their problem. They want to buy widget X. Widget X has a comprehensive cost. Whatever that cost is, that needs to be negotiated for. And I know that it is really easy for me to say that here. I'm not saying this is easy, but I think there is a cultural change that needs to be shifted, as well as a practical change in terms of those kinds of contracts. So sector needs to walk away from those service provisions sometimes. It needs to get the support of the community to understand why the contracting needs to be more effective, but also it needs to work with government for government to appreciate what the costs are. Because at the end of the day, the widgets are unaffordable, then less widgets will be provided or quality will be. And then those costs then need to be picked up in other parts of the government budget. So there is massive cost to government, whichever way they go, they've got to pay for it. What we want, I think all of us, is a more efficient system that allocates the costs initially, rather than waiting for, as in the WA example, of NDIS failing, so let's get the health department to pay for what we've already. Transparency is the key to that. We need to have much more transparency over transactions. Yep. Okay, where am I up to? Project steps. So just in relation to this project, and again, it's been great to team up with TASCOSS and the Peaks in relation to trying to get this project underway and to be able to collect sufficient data to understand what's happening in the sector. And this is a real challenge to us, as I'm sure you're well aware. Essentially, the project steps are to collect what we call representative historical data from participants for financial years 19, 20 and 21. And again, we have to use those years, even though we're well into 22 now, for a number of reasons, not least of which we triangulate that data with Treasury data as well as ACNC data to make sure we're getting it right. And I guess one of the things that we're petrified by is the idea that we get some of those calculations wrong, and that then undermines the legitimacy of the whole project, and we're really, really keen for that not to happen. So looking at 2019, 20 and 21 data, we have asked a panel of organisations that we think are representative of the sector in Tasmania to provide that data. The idea being that once we've got the data and analysed it, we can extrapolate that data across the whole sector. So the better statistical relevant data we get, the more we can use that data to say this is what's happening within the state as a whole. We want to compare then, after calculating the Fisher Index, looking at indexation that government's provided and looking at some other models, including models that the ABS are already collecting data on, we want to compare those elements to identify what the gap might be, if there is a gap, in terms of indexation provided compared to what indexation could be. We also want to look at those models to see if we can identify a proxy for indexation that will allow us to reduce the ongoing cost of data collection and analysis and development of that model outcome. So at the end of the day, we think it's really important, if there is a proxy extant that ABS continually manufactures on an annual basis, then if that's close enough, then that would be the proxy we would suggest you use, rather than collecting data yourself because of that cost inherent in that. We then want to compare that to, as I say, those aggregate industry models and also aggregate proportion of cost. So what are the proportion of cost to income, which we think the proportion of cost to income is going up. And that's previous slide where $213 million worth of income paid for $200 million worth of expenditure are a great example of that aggregate income changing. And then we want to arrive at a workable model. So we'd like to be able to recommend that this is the model Tasmania should adopt. Hopefully a model that doesn't require a lot of investment. But we do want it to be a collaborative approach. We're really keen to work with government as well as the sector. We think that's really important. And indeed, we think it's really important to be a no surprises approach to this as well. We don't want to be issuing reports and going to the media. We want to actually work together to try and come up with an arrangement that's going to make sense for everybody. Yeah, of course.
About those these are obviously COVID years, so that'll be a bit affected by that. How will you factor that in?
We've got a number of tests in relation to the COVID years, including some tests looking at ACNC data and general economic data. So one of the documents we'll produce around this, we'll publish it, but I don't think that we should actually step through exactly this. Very happy to talk to that.
Sounds fascinating.
Thanks so much. Yeah. I know, I used to say I was an accountant and people would fall asleep. A statistician, my gosh, they're asleep before you finish the word. But I'd be delighted to talk to anyone that has interest and to provide that.
So you are factoring in.
Yeah. There are tests we can use to be able to make sure that the economic outcome is legitimate.
Just, will that workable model apply, will that be useful for one-off, that the last point, which is a real conundrum for a lot of our organisations are receiving funding in a one-off type way
Yeah.
for services that kind of, have an ongoing demand.
Yeah.
So really, will this be useful for people to be able to kind of be more assertive around how much they're actually costing?
Look, I think that's a whole different realm. So yes, is the short answer. If you're getting 2.5% indexation and the indexation should be 5%, I got no idea what it should be. We haven't done the calculations. I'm just showing a variation. Then there's a 1.5% gap there that is demonstrable. But I think too that organisations really need to know their contribution margins for their services. So in other words, actually know the. I think this is a really important issue because one of the myths that's built up around the sector, and I think it's perpetrated both by governments and also people in industry that volunteer on boards of not-for-profit organisations. So people that have good people, well qualified, but come from a different world. They keep talking about economic opportunities for economies of scale. The pricing is so low, there are no economies of scale. And our best guess looking at the disability services sector, looking at the aged care sector, looking at a number of human services sectors around the country is the bigger you are, the less financially sustainable you are. The smaller you are, the less financially sustainable you are. There's a sweet spot in the middle that seems to be where people are focused on what they do really well with good relationships with organisations that pad out their services, for want of a better phrase, but conglomerates are not successful financially.
John Paulie, this is a really related question.
Yeah.
What's your view of using a cost equivalence basis, which goes on to say salaries within the not-for-profit sector tend to be lower than within government and services are often supported by a large volunteer workforce.
Yeah.
So this in effect leaves government a huge saving than if they would deliver.
Yeah.
So that cost, that's kind of what you're talking about.
Yeah, look, I think that's already eminently demonstrable, and I think every state, territory, and the Commonwealth government know that. That's why they put the services out to the not-for-profit sector, because they can't. So disability services is something that's sticking in my mind. The costs for delivering disability services run at 175% for government compared to the same service delivered by a not-for-profit organisation. So the payment that's required of public awards, the other attributes around that mean that it's an extra 75% to government to do, which is why they're funded.
We're right on 2 o'clock.
Okay,
so,
sorry.
5 minutes or so, if people can.
Just just very quickly. Yeah. Just very quickly then to wind up. So there's a couple of silver linings to the cloud, I think, in terms of the challenges of all of this. One of those is that technology can now be used to collect data automatically. And I think we're certainly working with an international IT firm to try and develop a model to do that, in which case, if we did a light on an industry-specific index, there could be a technological response to the cost of data gathering, if that makes sense. Part of that is also in the Australian Non-Profit Standard Chart of Accounts, which the Tasmanian government adopted going back a while. I forget how far back, but there is, if you like, accounting infrastructure that's been created nationally that can also be applied to then make sure that the data's in the right boxes, which means when we drag it down, we can analyse it much more quickly and much more easily. So I think the sector getting together with government also has the opportunity to build systems that can actually use technology to respond to this challenge, if you like. Finally, I think one of the things that this whole project around sustainability does is to provide certainty to providers, but also most importantly, I think, to provide certainty to government. And so one of the things that I think needs to be added, I know you've got a 10-year industry plan at the moment, but I think an industry finance plan needs to be attended to that so that you've got the financing structure identified for the whole period of that plan, not just the social and reporting structure, but the financial structure that goes to support as well. Okay, I think I've spoken pretty quick and a lot of stuff.
Well done.
Really, I'm happy to keep taking questions or comments, or do we have to I'm really happy with whatever you want.
I just want, before I just, aware
Yeah.
that people are probably about to sign off, and I just want to mention about the importance of participating in this project.
Absolutely.
Because we can only be successful in this project if we have organisations who are willing to provide us with their data. We know that in some other states, the project's been going on for up to a year because they've been really struggling to get that engagement from organisations. I understand it's a whole day and it's a big task and a big ask, and we're all feeling under-resourced and time for it. I'm not looking at anyone. But if there's any way that you think you could make the time, like, we would really appreciate it. I think it's really important that we finalise this project as soon as possible, that we have the report, that we can start to do some advocacy as an industry with government and really get this across the line. So if you're struggling with time, might be some ways that TASCOSS could help you, but please just contact us if there's even a glimmer of hope that you might be able to be part of the project. Thank you to those that already agreed to participate, but yeah, we really need more organisations. So I really want to just emphasise that. The other thing is David is here until tomorrow, and we've got a session this afternoon with some key government advisors. And we've also got a session tomorrow with some staff from Treasury, as well as another community services industry organisation session. So, yeah, if you want to ask any questions of David in the time that he's here, I'm sure he'd be more than to provide that. But I just really want to say thank you. I think it's been a really fantastic session, a great overview. I know that we're also happy to continue this conversation in whatever way we can, because we're really committed to this project. And we think it's different. So thanks for joining us, particularly people online. Thank you.
Dave, there are a couple more questions. Yes. I mean, if people just want to kind of stick around, but we can feedback. So one of them is wondering if there's any international best practice, what are people doing internationally?
It's a really good question. The short answer is no, there isn't. So we're, I think one of the things, and again, it's another whole afternoon's discussion really, but we are applying in Australia what we call quasi-market funding arrangements or pricing arrangements. So that's where we pretend there's a price and we pretend that there's a demand supply model and so on. And again, poor old NDIS is a classic example of that process. What we've found internationally is that these systems were tested in America, the UK, France, Germany, Spain, Argentina, get the other countries 10 or 15 years ago, were all found to not work. We have to go through the same process, unfortunately, to get to the other side of that tunnel. But at the end of the day, what is working is close compacts with the sector and mutual collaborative budgeting processes where the sector and government gets together with advocacy people, so people advocating for service users, and actually creates this financial. So to me, a 10-year financial plan, I always think a 5-year financial plan is probably the right horizon for finances, because once you get over 5 years, you really are crystal ball gazing. But you've got a 10-year industry plan. Why not have a 10-year financial plan appended to that? Because I think it's a really. The other thing too is that there's nothing, there's no silver bullet to all of this stuff. People kind of think, well, accountants, economists and others will come up with these ways of doing things. Fundamentally, this is taxpayers' money being used to be applied to services and supports that the community obviously wants to have supply. It costs money, and we need to sit down and work out where the money comes from, how much the money should be, and what the priorities should be in that regard as well.
Other thing was it costs government 175% to deliver a service. Surely there is a case of shared gains from having the service provided by.
The problem is a lack of transparency there, and the fact that this transfer of responsibility has been undertaken for about 20 years. I think government's forgotten how much it costs to deliver services. Thanks, folks. Really nice to see you.